My name is Benjamin. Today I'm going to be demonstrating the female Foley insertion. First thing that I'm going to do is I'm going to confirm that my patient has an order for a Foley, then I'm going to look at her record to see if she has any restrictions that I need to be worried about. We've already closed our curtains, so we have patient privacy. I'm going to introduce myself to the patient, confirm that I have the correct patient through the use of name, date of birth, and then I'm going to cross-reference that with her wristband. And then I'm going to explain the procedure to my patient. We're going to be doing a Foley insertion today. Then the first thing that I'm going to do is I'm going to take one of my waterproof pads and I'm going to put on a pair of clean gloves. I'm going to take my waterproof pad and I'm going to position it underneath my patient's hips. And now I have all my stuff here in my basin. I'm going to perform peri here. This would be out of the basin because the basin would have the soap and water in it. Soap and water in the middle. Now that we're done with this, we're done with our care. We can discard this. Then I'm going to take a dry towel and I'm going to pat dry. And I'm going to doff my gloves. I'm going to perform hand hygiene. I should have performed hand hygiene before I did that. Okay, now I'm going to get my basin out of the way. I'll go ahead and open my Foley kit. And I'm going to take this and I want to sort of turn the top inside out so I can use this as my waistband. That's going to go right there just for the convenient placement of it. And as I open my Foley kit, I'm going to make sure to not open it towards me at all. It preserves stability. Normally these wouldn't be on top, so we're going to put those underneath the sterile gloves. Then I'm going to put on my sterile gloves.
Little glove malfunction.
Yep. Alright, we got gloves on. At this point, I would ask my patient about any allergies to latex or iodine. For this scenario, we're going to have our patient does have an allergy to iodine. So we're going to take our iodine, discard it. Then I'm going to take my sterile drape, unfold it. Place it on the patient. Shiny side down. Then we're going to take a privacy cap. And we're going to do the same. Unfold it. Shiny side down. another waterproof bed, my sterile field. And my sterile field is going to be the same. It's going to go shiny side down in between my patient's legs. Normally I wouldn't reach over to preserve sterility, but I'm just practicing to do that. I'm going to reposition that sort of next to my patient's hand. Now what I'm going to do is I'm going to move that right over there. I'm going to put these in my sterile field. I'm going to get these set. And now what I'm going to do is I'm going to take my hydrogen peroxide, I'd open it up. I'm obviously not going to do that today to preserve the supplies. I'm going to get my cotton balls all covered in the hydrogen peroxide, and I'm going to discard the container for that. Now I'm going to take my tweezers. I'm going to take my tweezers. I'm going to grab one of the cotton balls, and then I'm going to use my right hand to spread my labia apart. I'm not going to use this. I'm going to use my right hand to spread my labia apart. Then I'm going to go clean in downward motion. Discard that one. Clean in a downward motion. Then I'm going to go down the middle. And I'm just going to do the same until I've used all my cotton balls. Okay, so now that my periclear is done, I'm going to discard that. What I should have done was gotten this ready before I spread my labia apart so that I could still have access with my other hand, since my right hand is now dirty. So what I'm going to do now is, before this I would have put my lubricating jelly right here. Then I'm going to lubricate 2 to 4 inches of the catheter. Then with my labia still spread apart, I'm going to have my patient tell her to hold her breath and bear down like she's having a bowel movement. And then I'm going to insert my catheter. Obviously for the mannequin it doesn't go in very far at all, but normally you go in about 2 to 4 inches till you stop feeling resistance, then an additional 2 to 4 inches as you're actually in the bladder at that point. Then I'm going to take my syringe. I'm going to uncap. Okay, I've got that in. No.
Filled your balloon.
Yep. And then I'm going to fill my balloon. I'm not actually going to do it today because we've been having issues with the catheter popping out and water spilling everywhere, so I'm not actually going to do that today. So then my balloon is filled, my catheter is in. We don't have a leg strap with us today, but I would secure the leg strap to the upper thigh right here. I'm going to take my syringe out because we don't need that anymore. Then I'm going to take my bag. I'm going to hang it on the side of my bed with provided rail. Then I'm going to dispose of all my supplies. Trying to maintain sterile technique as best as possible. Get my patient cleaned up. Get her covered up. Get her legs back down. And I lower her bed and get her bed sheets back up.